to talk about isometric exercises for the upper extremities, which includes your shoulder, elbow, wrist. Isometric exercises, by definition, is strengthening exercises without movement. So if I use my elbow as an example, so my bicep here, whenever I flex, you see my elbow actually move. So if I resist my hand, if I flex my muscle, or even if I don't resist, I just flex my muscle without motion, we call that isometric exercises. These exercises are useful in an early phase of rehab when you might have more pain or you're just recovering from some acute injury or inflammation. The idea is to do these gently, definitely without pain. I will demonstrate them in the following segments. For the shoulders, we have 6 motion exercises. Basically, you could go forward, backward, we could go out and in, and then we have these turning. We call them external and internal rotations. You probably see these from my previous exercises. Here I'll show you how to do the shoulder isometric. The first direction is the flexion. I'll pretend this is a wall. You could basically punch into the wall. If you find your hands a bit sore, you could use a towel. So I'm gonna keep my elbow bent at 90 degrees and just punch in. So basically I'm trying to go in this way and hold. So I will usually do these 5-second hold, about 2 sets of 10 repetitions. So that's going forward. Now, if I flip backwards, pretend that this is wall again, use the towel, you could actually push back, like giving somebody an elbow going that way, okay? So that's the extension. So the next two are abduction and adduction. So if you use the wall, you could put the towel here, try to think about maybe pushing your forearm into the wall. That's going out that way. That's the abduction. The adduction usually would just squeeze into your body. Again, you could use a towel there to squeeze in, or some people use a pillow. Basically, you're just gonna bring that in towards you. So that's the abduction and adduction. Then we have the rotation. So if you pretend, I think like a door frame is the best, so you have some room to move around. So basically, we're gonna swing around. So I'm gonna go in here. So I'm trying to spin my hand that way. Keep it bent at 90 degrees. Use the forearm part to push. There we go, okay? Now for the internal rotation, obviously I'll make the door frame on this side. But I'll just show you by crossing over. On the wall there, you could push in this way. So you could spin it like that, okay? So I guess this would be the wall and you're spinning against it. Okay, so for the elbow, basically we could bend up, go straighten, and then we could do this spinning. So basically, you're gonna flex your elbow to 90 degrees. You could use your other hand as resistance. You're gonna push against it, 5-second hold, and 20 times again. For extension, same idea, you're gonna push down towards the floor. I would do it with your kind of hand in this position. You don't have to turn it, okay? So we're gonna just put it down like that. Okay, that's extension. So for supination and pronation, which is the spinning, I will show you. I would normally do it by your side to do it, but I'll demonstrate it by pointing to the camera. So basically, if you point to the camera, go over here, I'm gonna turn my hand this way. You're gonna try to turn your forearm that way by resisting myself. So that's what we call supination, okay? So I'll go over usually on top to pull this way. So for the opposite, I'm gonna do under here. So basically, I'm gonna try to turn it in. I'm gonna use my hand to block it that way, okay? So I'm gonna turn in this way, okay? So I just demonstrated a little motion, but really you could do it without much motion. So that's what we call supination and pronation. So for the wrist, we have 6 motion. We could do extension, flexion, then we have to do these karate chop of down and up, and then we have the spinning again from the elbow. So the pronation and supination, we kind of did it with the elbow already, so I'm gonna just do it on the wrist. So basically, if I put my wrist out, you can rest it on a table, something by your side. I just wanna show you here. So you're basically gonna push down and it's gonna come up. So my wrist stays relatively straight. You don't wanna cock it up too high there, okay? So we're gonna go, and if you wanna relax your fist, just go up there. So up that way, which is what we call extension. We're gonna do the opposite, which is pushing down. So I'm gonna push down. That's called the flexion. And then we have these karate chops. So basically I could try to chop down, use my hand to block it. That's what we call it ulnar deviation. And the other way is coming up to the sky, we call that radial deviation, and you block. And then so again, we talk about the supination and pronation in the elbow segments. So for the legs or the lower extremity, we have 3 joints, mainly the hip, the knee, and the ankle. So for the hip, we would do flexion first, which is lifting up to the sky. So if you simply take your hand and trying to push down towards the floor, you're gonna just go gently against it towards the sky. Your foot just need to clear the floor just a little bit. Don't try to lift it off too far, okay? So that's flexion. For extension, the easiest way is if you try to push your foot down to the floor. So from the side here, my hip, my knee is gonna stay stable. I'm gonna push it down, my foot, that's all. So that will get the extension. For the hip, we call the abduction and adduction. The easiest way is if you use a ball or a pillow, you're gonna put it between your knee and you're gonna squeeze it in. That's what we call the adduction, okay? So that will, or I call it a closed book, basically gonna close the book. Now for the open book, if you try to open your leg, you're gonna use your hand here and try to go against it. So that's what we call abduction. Okay, then we have the rotations of our hip. So by definition, if I put an axis through my thigh, when I spin it this way, my thigh is turning that way. So we call that external rotation. If we go the other way, we call it internal rotation. So in seated positions, I'm gonna use my other foot to block it. So basically I'm trying to move my foot in this way, and that's a resisted external rotation. Okay, so feel like you wanna try to spin it, okay? Don't try to like move the whole leg in. And then the opposite, if you take the foot, go the other way to block it, then you could actually try to spin that way. Again, kind of going like that. Or sometimes we call these windshield wiper because you end up with a motion like this. Okay, so for the knee, we have extension, which is straightening, and flexion, which is bending. So I'm gonna use my good foot as the block. Basically, this foot I'm gonna try to kick out. I'm gonna just use my other foot to come back into resist it. So as if you're gonna kick out with this right leg, but I'm blocking myself. That's the extension. Then we flip it over, you try to bend it back, use the other one to block it, to fight it, basically. That's extension and flexion of the knee. Okay, so now for the ankle, we have dorsiflexion, which is coming up, plantar flexion, which is pointing down, and then we'll go spin our foot in and out. So I like to do in seated position, so you basically try to go up to the sky, use your heel to block it. So I'm going to try to lift my foot off the floor and just fight yourself. So that's dorsiflexion. Plantar flexion, you can really just try to push your front part of your foot into the floor, kind of like your gas pedal when you're driving, okay? And then so we have eversion, which you're trying to spin up to the sky. You could take other foot to block it and then trying to go against that way, okay? So it's a bit of a spin, but also try to lift it up. We're gonna fight that way, that's eversion. And then inversion, we're gonna try to come in, almost like, unfortunately, when you sprain your ankle, you're gonna use your other foot just to block it, okay? So there are the lower extremity isometric exercises. I try to do them in a seated position because it's more convenient.